A new transparent global system should be set up for probing disease outbreaks, empowering the World Health Organization to deploy investigators at short notice and reveal findings, a COVID-19 pandemic review panel said on Wednesday. The WHO should have declared the new coronavirus outbreak in China an international emergency earlier than January 30, 2020, but the next month was lost as countries failed to take strong measures to halt the spread of the respiratory pathogen, it said.
Whilst the virus was spreading, information was being hoarded and decisions were delayed whilst waiting on responses to laborious exchanges of official emails. As information began to arrive at WHO, the organisation was not sufficiently empowered to investigate, validate, and then confirm at speed that a dangerous outbreak was occurring.
The independent experts, in a major report on the handling of the pandemic, called for bold WHO reforms and revitalising national preparedness plans to prevent another toxic cocktail.
This is an ongoing disaster that we believe could have been prevented. The evidence shows that an outbreak became a pandemic because of failures, gaps, and delays in preparedness and response. This was partly due to a failure to learn from the past. We believe, however, that even with the current systems, a public health emergency of international concern could have been declared by at least the 22nd of January. Even following the declaration on the 30th of January, February was a wasted month. Despite clear warnings, far too many countries believed it would not affect them, and they adopted, in effect, a wait-and-see approach.
Right now, demand for vaccines is outstripping supply. If all the existing vaccines were redistributed, the total amount available would still be insufficient. The United States announcement of support for a TRIPS waiver is a vital step in the right direction. But we need voluntary licensing and knowledge and technology transfer agreements now. We call on the World Health Organization and the World Trade Organization together to convene the major vaccine producing countries and manufacturers to get agreement on that. If there's no action within 3 months, we think a TRIPS waiver needs to come into force immediately.
The world was not prepared for this one. It must be prepared and ready for the next. Pandemics are an essential threat to humanity. Yet outside of a crisis, preparedness is all too often relegated to the ministries of health. This pandemic has shown the importance of multilateralism, global leadership, and whole of society and government approaches. Therefore, we recommend a creation of a Global Health Threats Council at the level of heads of state and government.
We look forward to reviewing all of these reports and to discussing them with our member states in the coming weeks. So once again, my deep thanks to President Sirleaf and to the Right Honorable Prime Minister Helen Clark for their leadership, as well as the panel members and the Secretariat. We look forward to working with our member states to discuss the recommendations of this panel and the other committees to build a stronger WHO and a healthier, safer, fairer future for all of us.
Journalists,
The panel praised the unstinting efforts of the WHO leadership and staff during the pandemic. It did not lay specific blame on China or on WHO director, whom the Trump administration accused of being China-centric, a charge he denied. But it said that a WHO Director General should be limited to a single 7-year term to avoid political pressure.